I'm Delfio Rubinstein. I am from Argentina, Buenos Aires. I was trained as a physician, and then I received a special training in family medicine and primary care. My first steps were related to clinical epidemiology in the late 80s when I was finishing my residency training program in Buenos Aires. I was discovering at that time the clinical epidemiology through, I remember, David Sackett, the startup of evidence-based medicine, and research designs in clinical epi, and that was the beginning. And I was teaching something about clinical research to our residents when I was finishing my resident training program, when I then was chief resident. And that was the beginning, but surely there was a gap in Argentina, and I think in the rest of the region too, in the southern cone of Latin America, about evaluation, how to evaluate your clinical practice, your public health interventions, and I grasp the need of quantitative medicine that was very much underdeveloped in our region at that time. I remember I knew a medical doctor who was at that time chair of the University of Texas at Galveston, Stephen Span, who told me about the clinical effectiveness program at Harvard, and Lee Goldman's and Frank Cook. And at that time, I decided, I made a decision to pursue that program, and I tried to go deep in what they were doing. I remember having talked to another guy from Texas who at that time was pursuing this program, the clinical effectiveness program. And then I made a decision, and I applied, and I followed the summer program in clinical effectiveness in 1994, 1995, 2 years, and then I got the degree of clinical epi in 1996 in Harvard. It was a process, and that started up with a walk through Broadway, Manhattan, with my brother, Fernando Rubinstein, who was just come from California. He got an MPH too. I was just graduated from Harvard. And we're walking down Broadway, and at the intersection between Broadway and Fifth Avenue, we saw the Flatiron Building, and for the first time it was inspirational, and for the first time we devised the idea envisioned the idea of creating a program model after Harvard's program in clinical effectiveness in Buenos Aires at the University of Buenos Aires. I would say that the core of the program is about training methods in quantitative medicine and analytical skills based on biostat and epi and decision analysis. I would say that probably 80 to 90% of the program is based on quantitative medicine. And I think it's the most important strength of that program, and that I think this part makes this program different from other programs in the region. So far, we have more than 10 years since the beginning of our program, and we have trained more than 300 graduates from all of Latin America. I think that practically all countries in Latin America graduates from Argentina, Brazil, Chile, Uruguay, Mexico, Peru, Haiti, Venezuela, Colombia. I think most of the countries in the region have graduates in our program. Well, I think it was a continuation of our master's program, because 5 years later, from the beginning of our program, we realized that we need something more formal in terms of research. We were creating capacities in research, but we need to have an institution to start developing research projects, and this is what we did by creating the Institute of Clinical Effectiveness and Health Policy in Buenos Aires with a regional focus, not just on Argentina, but also on the entire region. And now we are having I mean, and based on quantitative research. And I would say that most of our faculty now in our institute, we have more than 40, 45 faculties on full-time basis, are former graduates of our clinical effectiveness program. And we have a lot of research projects, and many research projects come from NIH. We are now having at least 17 different research projects from NIH, different institutes of NIH. Probably it depends on the dimension you analyze the problem. You could see as a big problem health disparities, and we have a lot of people uninsured or sub-insured, and this is quite a big problem in Argentina and the rest of the region. On the other hand, we are having the burden of chronic disease, cardiovascular disease, cancer, which are where our healthcare systems are not very well prepared to counter. And I would say that those probably are, and at the same time, we are still dealing with infectious disease and perinatal causes of death and disability. So we are facing the double burden of disease like many other developing countries in the world. Well, I think quantitative medicine is key to address these problems. I mean, if you don't have data and you cannot analyze seriously and rigorously those data, you cannot make any progress. So policy research must be based, and clinical research must be based on quantitative data. I think we are building the critical mass in our country and in the region. I think that our institute is getting successful because it is reaching this critical mass to do research, to train people, to expand quantitative medicine across the region. We recently surveyed our former graduates. What are you doing now? What was the value of our program? And we receive a lot of very encouraging responses. I mean, I would say that many of our former graduates are now directors of hospitals or policymakers, or they are working in the pharmaceutical industry, in all the healthcare sectors. We have people in Argentina and also in other countries in the region. So I think it's like an expansion, and some smaller programs are being modeled after our program in the region. So we are trying to get some satellites in the region too.